of a couple of items to take action on so that we, Washington County, can continue our progress towards meeting the needs that are required for us to reopen with phase one of that strategy. So without further ado, we'll move on to our action agenda for today. The first is to approve a vendor award and execute contracts for Oregon Public Health Institute and Express Healthcare Professionals. And we are going to have a staff report on this from our Interim Director of Support Services and our Chief Financial Officer, Jack Liang. And Tricia, I've blanked out Mortel. Who is one of our key directors here in public health.
Thank you, Chair Harrington. Good morning. For the record, my name is Jack Liang, Interim Director of Support Services, and we are in front of you to present an action item under Support Services, which consists of two contracts, one with the Express Healthcare Professionals, the other one with Oregon Public Health Institute. Now, Tricia Mortiel from HHS is with me today to provide the details of these contracts. But before we jump into the details, I just want to highlight that this is a true collaboration effort among CAO staff, County Council staff, Health and Human Services, as well as Support Services. And these contracts are put together, I would say, in a quicker manner than other contracts that's in the county. And it's a true amazing collaboration of how fast all these teams rallied and came together, discussed with the vendor, come to acceptable terms, and there's a lot of staff actually participated in that area. I want to highlight especially with the leadership of Marnie Kyle of HHS, as well as Eva Labonte from Support Services. These are the two key members that really took this project and ran it with super speed. So I just wanted to mention that. With that said, I will pass it to Tricia to provide us more details on these contracts.
Good morning, Chair Harrington and Commissioners. Each of these contracts put us in a good position to have the base staff hired and trained by our projected dates of reopening. As you all heard on the call with the governor's office last week, we don't have to have all the contact tracers ready, but we need to have enough. We need to be able to contact 95% of those who have tested positive within 24 hours. These contracts include scalable staffing up to the maximum we anticipate needing and a way to ramp down, luckily and hopefully, when we are ready. They also support hiring of local staff. Our goal is at least 30% who will be bilingual, bicultural. As part of the chair's recent meeting with community-based organizations, we have already started the process of encouraging referrals from those communities. First is the contract with Express Healthcare Professionals for nurses. Although you've heard a lot about contact tracing, the work really starts with case investigation. Nurses are the ones who contact someone who has tested positive for COVID and begin to uncover where they might have contracted it and who they might have passed it on to. They also will work quickly to learn who of those people in that first circle are ill right now with COVID-like symptoms, and they need to facilitate getting them tested. This is new work. We have not been focused on that when in this current phase. So an important part we all have to live with is we will get more people tested, and that means we will have more cases. Our average since the 1st of March is 315 a month. We expect that to triple as we begin this work. In addition to case investigations, they are the ones who will determine businesses needing to be informed and helping businesses determine what is the potential for spread in their work setting. They already do and will continue talking regularly, sometimes even daily, with those facilities, especially congregate care facilities, to learn if the disease could be spreading and determine what more we need to do to stop that spread. Express Healthcare has already located the total number of nurses that we anticipate needing to hire as temporary workers. Once we execute these contracts, our internal team will start the work of getting them trained, as most of the nurses that we have working in our team will need to go back to providing other services that we have shut down during this phase. The second is the much larger contract with the Oregon Public Health Institute, a local nonprofit organization who's partnering with their counterpart in California, the Public Health Institute. PHI has experience in putting in place staffing structures for contact tracing in their state. But as I mentioned before, they're expected to hire locally. They will be able to hire the 30% of staff we feel we are necessary to begin implementation by the end of next week. Then they will begin assisting us with training those new staff. Contact tracers will be calling all contacts and gathering more information and instructing contacts to quarantine. Again, something we haven't been focused as heavily on. They'll then be calling them daily and monitoring what is their health status. Marnie recently showed you in one of her presentations an infographic about how quickly this body of work will increase. Contact tracers will be talking with thousands of households daily, making sure they can quarantine to avoid spreading the disease in the community, and helping to facilitate the information about when quarantine can end for that individual and that family. But in addition to those contact tracers, those 90 you keep hearing about, there is a lot more resources needed. OPHI will help us with hiring of other staff needed to work to mitigate disease spread. First, our epidemiologists. Contact tracers give us a puzzle piece, but the epidemiologists look to figure out if those puzzle pieces fit together. We need to know quickly if the disease is spreading in a workplace, in a place of worship, in a childcare, because all of those things are opening up again. They also dig deeper into the data to look for disparities so that we can focus and target our efforts on community engagement and education, such as the work we've really struggled and focused on doing with our Latinx community who has been disproportionately impacted by COVID-19. We also need staff to help with data entry, as all of the information the contact tracers are gathering needs to put into the state database. This larger database allows cross-border surveillance and analysis to occur and informs us even further about the rate of disease spread across our communities. And as you know, we are 3 communities in this metro region who have a lot of cross-travel with our populations. So when you look at the number of staffs needed in these contracts, it's more than the 90 contact tracers that are being talked about in the news. But they are the largest amount of resources we need, but not the only resources we need. Anytime I get a chance to share information, I need to remind us all that contact tracing is not the magic pill or vaccine we need. Isolation and quarantine is what will be needed to slow the spread. The resources needed for all individuals and families to voluntarily isolate and quarantine is a very important part of our financial needs for COVID-19. We know that many families have lost jobs and depleted their financial resources, so we need to support them with basic needs such as food. It will be critical to our successful reopening. And I can answer any questions about the contracts.
Commissioner Skelton?
Yeah, I know that, I know you're moving quickly, but maybe you might explain to some people who think that we've been a little slow on this, that we should have been, like now.
Yeah, thank you.
Can you sort of lay out when the guidelines were first available to us, why that's important in terms of when we could actually start to think about hiring people, provide a little more detail, because there's frustration out there that we're not looking up earlier under phase 1.
I understand. So new investigative guidelines came out on May 1st, so I believe we're May 15. I have trouble remembering what calendar day we're on, but in the last 2 weeks, we've been looking at the investigative guidelines and determining the body of work. Prior to that, we'd been working with the state, with the Oregon Health Authority, to determine what was the best method for staffing up across the state and across each county. At that time, we had determined that the state has the resources to do surge capacity. So again, if any county got into a position where they were having trouble meeting that 95%, the state would deploy a surge capacity. The state's also responsible for things like the new database that we need for contact, the daily monitoring. We do not have that in place. They have not deployed that yet. We are still waiting for that new database, and we expect that in the next 2 weeks. So it's not been ready for communities, and particularly a community as large as us. If you're a very small rural or frontier county that's doing daily calls, it will be a small number. In our large metro region, those daily calls will ramp up immediately to very large numbers. So we need a database to be able to capture that data.
Okay. And I assume that there needs to be a certain uniformity across the state with respect to reporting protocol and all of that.
Yes,
Otherwise, we're not going to be comparing apples to apples. We're going to have flawed data.
Yeah. That's part of the new investigative guidelines, which again came out on May 1st. We have not instituted those investigative guidelines at this time because they move us to isolation and quarantine and the reopening, phase 1 reopening. So that's all coming together at the same time.
Thank you for asking those questions, Commissioner Scout, and I learned more about what it takes for us as a community to transition into phase 1 of reopening. Any other questions from commissioners? And now is also a good time for any comments. Well, no, we'll have to get a motion on that first, sorry.
I have a question. Are we coordinating with any, and I may have missed your answer there, so I apologize if that's the case. Are we coordinating with any private sector industries that are doing independent contact tracing within their organizations? And how are we coordinating with other counties? The information goes back up to OHA, is that correct?
Correct.
Okay.
I'm not sure I understand the first part of your question. I don't know that any other independent agencies are doing contact tracing.
Actually, the question is more about some of our large companies, I'm not certain, but maybe doing contact tracing within their
Okay,
organizations.
great. Yeah, I understand the question, yeah. So public health is responsible for contacting all positive cases, and going back to the conversation, we work with the business to help them further determine who would be contacts within a business and work with them to inform contacts of what they need to do. It looks like Marnie wants to add something.
So coming up to the table is our Director of Health and Human Services, Marnie Kyle.
Good morning, Chair Harrington and Commissioner Treese and Board. I think maybe what you're asking, because part of the phase 1 guidelines for businesses is to consider setting up a system so that they can assist with contact tracing. Mm-hmm. And so they've been asked to consider things like keeping visitor logs and
Yes.
That sort of a protocol. And so I think that those kind of protocols, especially for really large employers like Intel and Nike, will assist our staff as we are doing contact tracing. So those will be they'll be way ahead of the game when they have those kind of protocols in place. And when we do call them, they can say, oh yes, we know Commissioner Willie and who's visited him and how often, and they'll be just ahead of the game. Sorry to pick on you.
No, thanks for sharing that, Marnie. And that is,
my line of sight.
and we will be looking at that here in our own organization as well. Thank you, Marnie, for that addition.
So what I think I heard you say is that you are already in communication with the larger employers in this area about making sure that there's information flow, or is that one of the upcoming steps in the protocol you'll be working on?
So that, as Marnie mentioned, that's the governor's recommendation that businesses will have information about who's been in their business, and so that when we get a case, when we contact the business, we work with them to get those, what we kind of call it a list, and we do this often. So for example, in the case of measles, if we contact, if we have a person who's gone to a healthcare facility with measles and we know it's a pretty easy transmitted, we call that health care facility and they can easily tell us the appointments they had at that time at that moment in their waiting room. So it'll be very similar to what we're used to doing.
Thank you.
Commissioner Rodgers, do you have any questions?
Comment maybe, and thank you. And thanks for the staff report. I think it's very important for those who are viewing to just reiterate what was said, because it's been said a number of times, but we're taking a number of comments and questions about why we haven't reacted more clearly. And this was pointed out by staff. They're doing an excellent job of giving you a timeline. We didn't really know all the governor's order rules until recently. We have to hire people to do this contact tracing, and it's very different than our colleagues in counties to the east, particularly, who have small populations. So it's not like we have people readily available with the skill sets and the ability to work right this moment. So I think that it's reasonable, and for those who are watching on the screen or those who are having lots of questions of my fellow commissioners, we're doing our best, and we certainly want to open up as soon as possible.
Which is also partly why we're here on Friday. as opposed to our normal Tuesdays. We're not waiting until Tuesday to get some of this done.
I don't have any questions. Are there any last questions from commissioners? So we have,
Okay, I move that we approve the vendor award and execute a contract for up to $1,825,150 for Express Healthcare Professionals and a contract for up to $9,092,000 for Oregon Public Health Institute to expedite public health staffing in response to COVID-19 pandemic to move this county to phase 1 reopening.
Second? I think there was that was a motion.
yes, that was a motion?
That was my motion, yes.
Yes,
And second.
and we have a second. Are there any commissioner comments on this action before we take a vote? I would like to make an additional comment to what I spoke about earlier. As I mentioned, this is one administrative step moving forward. We continue to have the science and public health leading us through this work, and I'm dedicated to that. I want to let folks know that we have been receiving individually as members of the commission, collectively as a whole commission, we've been receiving a lot of calls and emails expressing opinions and concerns either way. Our staff has given me information that I'd like to share at this point. Just this last week, we've received over 50 calls and approximately 120 emails that fall in the following 8 different categories. Questions about when will the county be ready for phase 1 reopening? Second, salons that want to open as soon as possible, and that would fall into the personal services guidance. Salons that do not want to reopen in phase 1. Those that want gyms and bowling alleys to be included in phase 1. And we have to follow through on the governor's, the state's requirements. So that is determined at the state level. Those that want youth baseball, softball, contact sports to be allowed in phase 1. Questions about what takes so long to hire contact tracers, and why weren't we already working to get more? And I think we've tried to answer those questions through our weekly presentations at board meetings, through our communications, and including here today. We received the final requirements from Governor Brown a week ago yesterday on May 7th. I have my dates right. So now we know what the scale is, and we're able to take the step forward to get the workers, the experts that we need to do this critical work. That's why we're having this emergency meeting today. Questions about, can my business reopen in phase 1? And I would urge everyone to go to the coronavirus.oregon.gov website. That is where all of the sector guidance information is posted, and the state has done a phenomenal job in improving that website. The last 2 buckets, what is the county doing to increase testing? Please go to our county website, co.washington.or.us. Our staff has continued to improve the information on our website and to make it easier to use. It's quite graphical. It's not just a series of words. And lastly, those that want to report a lack of physical distancing and masks at certain businesses. The Washington County Emergency Operations Center, EOC, does have resources available for people to report instances where they think social distancing is not being administered in various businesses, as well as where to get additional personal protective equipment, and I know Commissioner Rodgers has helped ensure that we have better information there as well. So I just wanted to give you a flavor for our knowing that we have a whole variety of not just needs in our community, but also thoughts and opinions. And with that, we have a motion and a second to move forward with these contracts. All those in favor, please vote by saying aye.
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 Any opposed? The motion carries unanimously, 5-0.
Chair, could I make one more quick comment? That was great information. Is that in printed form somewhere on our website as well, that information about 95%, the testing requirements, the database? That was really good information, and it certainly responded to several of the questions we've gotten as the chair in.
A lot of that is on our webpage now with the prerequisites, but we'll make sure that it's, we're continuing to update that. OHA has put up information on their website yesterday about prerequisites, about testing, for example. There are two parts to the testing. One is a testing across the region, and one is testing vulnerable population and underserved population access, and that is the county responsibility. So there's a couple of other contracts moving through quickly. We'll be contracting with our neighborhood health center, Virginia Garcia. We already are contracting with Metro West to make sure we have those resources so we could do that hotspot, just-in-time testing, in addition to making sure testing is available for anyone in the community.
All right, yeah, I just wanted to make sure as you hear the commissioners, we get asked a lot of questions and we don't know, so we just want to make sure we can point them back and get the information on the website.
We're working on that. You're welcome.
Thank you for your time this morning.
Thank you. And next up is to consider adoption of the Emergency Operations Center COVID-19 reopening plan. We'll turn it over to Marnie Kyle.
Okay, good morning again, Chair Harrington and commissioners. So, and some of this is just for other folks listening, just to
Yes,
give a little
please.
bit of history. But as a reminder, on February 28, 2020, the first case of COVID-19 in Oregon was identified in Washington County, and it was determined to be due to undetected community spread of the virus. Washington County Public Health quickly organized and began the tracing of close contacts. Since that time, hundreds of cases have been identified. The disease has sickened people of all ages. A majority of those hospitalized or dying have been older or with underlying conditions, but it has sickened people of all ages and all throughout our community. As of May 14th, there were 619 cumulative cases within Washington County residents. 12 residents have died, and Washington County continues to account for approximately 19% of the positive cases in the state. On April 14th, with evidence that physical distancing and other preventative disease control measures were working, Governor Brown announced a framework for reopening Oregon. It was a very high-level framework, and as you've heard, the actual final recommendations didn't come out until May 7th. The framework had three major tenets. There were prerequisites and protocols that would allow counties to pursue a progressively more relaxed series of restrictions, including phased lifting of restrictions, an increased public health capacity to do the disease investigation, conduct screening, ensure that the testing, everything that Tricia just so wonderfully explained to us, that we had sufficient levels of PPE and surge capacity within both our public health and our healthcare system, and that we could conduct education and outreach, especially to our underserved communities. So today, and you've heard this a few times today we are taking an important step toward reopening Washington County, but I want to be very clear. What we are doing today does not signal that we are ready to submit a plan to the governor or to Oregon Health Authority. We will not submit our plan for approval until we are confident that we meet all of the governor's prerequisites and can recommend moving into phase 1 safely and protecting our residents' health. So the board first received the version of the reopening plan last Friday, May 8th, and had an opportunity to discuss the draft plan together at your board work session Tuesday, just a few days ago, on May 12th. The plan before you today includes the changes that we think we heard from you during the meeting that you requested and direction that your board provided. The draft plan was shared with community partners, some of our community-based organizations, city managers, mayors, and city managers yesterday, city emergency managers yesterday, sorry. So we did get some feedback from a couple of city managers and have answered some of their questions. And we heard a little bit more from the city managers this morning on the 8 a.m. call. So we do have, and if we could pull up the one slide now. So we do have a few changes that we are proposing even from the draft that you have before you today that you're being asked to approve. So we felt like we needed to expand the definitions of agencies that we will be coordinating with. So they caught one more organization to add. So it would now read local and regional coordination. Washington County will collaborate with and coordinate with cities and other local governments, community-based organizations, Health Region 1, regional partners to ensure a united and consistent approach. So we added the other local governments to that string.
We think service districts all the time, but we need to make sure we add that clarity.
Yes. The second one is some clarity around the metrics. And so we added, so COVID-19 is unpredictable, so there's that sentence in there. A large upswing in positive case counts, hospitalizations, or fatalities. So we needed to add hospitalizations, so it was just a missed word. It's been part of the prerequisites and the criteria that we've been following all along, and we know will continue, just a missed word. The third is clarify applicability of the CARES funding. So the sentence would now read, many of the costs incurred by the county and its partner in the reopening process may be able to be recouped under several state and federal programs set up to fund COVID-19 response and recovery. So that was added. And then the last piece, other than some grammatical issues and some formatting, extra A's or numbers here and there. So the last piece that's substantive for your consideration is clarifying the approval process. So we did fix the graphic, but we need to clarify that the application will be submitted to the county administrator, who will consult with the Board of Commissioners before submitting to the governor's office. So we fixed it in the graphic, but not necessarily in all the narrative. So our recommendation this morning is approval of the plan with these additional clarifying language, which I hope was helpful to have it up in front of you, because as you have your discussion, you might forget.
So we would be adopting an amended reopening plan.
Yes.
That will be dated today.
That would be dated today with these fixes.
Changes. Yep.
Yes.
Questions from commissioners?
Yeah,
Commissioner Skelton.
Just a comment, and I know that the governor's meeting with the mayors and Washington County legislators this afternoon, and I was very impressed. I thought it was very timely, the memo and all of the reference materials in our chief of staff's correspondence, I think, to the city managers and the mayors a couple of days ago, May 13th, I think it was. That was great, because that was kind of the stuff I was looking for, and I had a chance really this morning to kind of go through everything. I thought that was very helpful, but maybe that's something that this plan is something we might want to share with with legislators prior to this afternoon as well.
Yes, I have a weekly meeting with the legislators each week, and it was provided. The version that we had for our work session on Tuesday was shared with them.
Oh, that's terrific.
One reason why we're all exhausted this week.
Yeah, well, it's good to let's put this out because, and to discuss this because, you know, trying to keep track of what all is going on
Yeah.
and communications and chain of command is a beautiful thing. And I mean, I'll just put it out there. My soapbox moment here. I wish that the Speaker and the Senate President and the Governor had spoken to us prior to sending that first letter, but you know, that's the way it is.
So Commissioner Skelton, for those in our audience, is referring to a letter that we received while we were in our meeting on Tuesday. And I have since responded back to them with another letter acknowledging their receipt and explaining how we're trying to thoughtfully and carefully proceed to meet the needs of the entire Washington County community while adhering to the requirements for this CARES Act funding, which must be spent by the end of the year on projects which are eligible through the Treasury requirements. Thank you, Commissioner Skelton, for those comments. I think we're very fortunate that we put in place a really robust communication system to help our community partners be informed at all kinds of levels. Weekly meetings with the mayors, they used to be 3 times a week, weekly meetings with legislators, and they all have our phone numbers too, and email addresses. Meetings weekly with city administrators, meetings with service districts, you name it. This week, ever since May 7th, the amount of information to ensure that everyone understands it, well, first, has the opportunity to know it exists,
Right.
let alone understand
Right.
it, has just been an incredible marathon. I want to thank all of you as commissioners and all of our staff at every level, in every department, for doing your part to help ensure that every member of our community has the opportunity of knowing that there is new information and where to find that credible information. Thank you very much.
You did a nice job on that letter in response to, so thank you for doing that. You bet.
I don't know that I've wordsmithed so much before versus this week.
You had referenced that you were doing some phone tagging. Were you able to actually reach the individuals involved, any of them on the phone, actually have a direct communication with them?
Nope.
No. That's,
I did, of course, have
I'm sure you tried your best to reach them, yeah.
I did have the opportunity to continue communications with my direct peers, Mayor Ted Wheeler, Chair Kafori, and Chair Bernard, multiple times this week.
Yeah. One other thing too, I think in terms of line of communication, I've come to learn just how centralized decision-making is made at the legislature. The Speaker and the State Senate really make a lot of decisions here and then share that with the rest of their caucus. So sometimes when we get information to our caucus, we need to think about how centralized that decision-making actually is made in the legislature.
Are there any other questions or comments from commissioners?
And I've lost track here just for a moment. Chair, we do not have a motion on the floor, correct? Okay. So, and I'm not sure if you want to answer this question following that, but I'm certain that at the end of this meeting, we will all get phone calls about what does this reopening plan do to the discussion that we had in terms of when our application will go in. Is there any changes there?
No. So I think that it's important to remind everyone that this is an important step that you're taking this morning, but it does not mean that we're ready to submit the reopening plan to OHA and the governor's office for approval. Our new website our web page on the COVID website, I think goes through and has a really good explanation of what the prerequisite criteria are and where we are in meeting that criteria. We will be able to upload this plan to that page or wherever the communication experts say we should put the plan. We'll make sure that this plan is accessible. Again, we don't recommend submitting the plan to OHA and the governor's office until we feel really confident that we've met all of the prerequisites. And I think that you heard Tricia say that OPHI and gosh, it escaped me, the other
Express
healthcare professionals believe that they'll have a lot of staff in place by May 22nd, the end of next week, and then we'll need to get training done quickly. So we are really moving quickly towards having a better date.
I would just like to add, so our staff is moving very quickly to meet the requirements and to ensure that we are prepared. We had the opportunity to hear from Patricia Mortel in the prior action item that the level of work to do these investigations increases significantly moving forward. And that's been really critical. And we're reliant upon this new state database that won't be available for 2 more weeks. So that's a pretty critical piece of infrastructure that's needed as well. Nonetheless, we each need to be very disciplined moving forward. The fact that more retail facilities, outlets can be open as of today, we're expecting that more people will be out and about. That means our interactions are more complex. We'll be having more contacts. All the more reason why we need to be meticulous about washing our hands frequently, wearing our fabric face coverings when you're outside of your home, all the time when you're outside of your home. And if you have any symptoms, please stay home. If your body feels off, please stay home. Some have been inconvenienced, some are living through incredible hardship. But let's remember that if we move too quickly, if we have too many people going to the hospital, there are also people dying and people experiencing and will continue to experience the long-term healthcare effects of contracting this virus. These are real people, individuals in our community. I hope that in all of our tremendous care in transitioning to phase 1 and onward, that we can avoid closure. That's a very sincere goal that I have. All the more reason why our efforts are being led by the science and public health, and that we're taking these administrative steps today. So please keep watching that great dashboard that our Washington County staff have put on our COVID page at co.washington.or.us. So I'd like to see if any of my colleagues have any final questions. Commissioner Rodgers?
I have a
Could we check
question.
for Commissioner Rodgers first, please?
Of course, yeah.
You're on mute. There you go.
Oh, they took me off. No, thank you very much. I don't have any questions. I think we can't state enough that we're all in favor of opening up at the right time. We're all attempting to do what we can. We're all subject to the rule of law, and the rule of law says there's specific things that we need to do. Those are being developed, as the chair indicates. There's information we're still receiving. So someone who's watching this or looking at this from the outside should not think that any member of this board is attempting to stall, drag their feet, in any way inhibit anyone. I'm in the small business world too, and I understand the pain that people are going through, and as do my colleagues. So it's good that we keep saying we are sympathetic, we're empathetic, we understand, we all want to open up. We can't violate state law. That's not what we were elected to do, and that we're doing our very best, and our staff's doing their very best to get this back open.
Thank you, Commissioner Rodgers. Commissioner Skelton, you had something more?
Yeah, just a comment and a question. Yeah, we have to strike a balance here to riff off of the chair's comment about science has to drive us. This COVID disease has turned out to be not only have serious respiratory implications, but cardiovascular, blood clots, attacking the brain, attacking the kidneys. We're now seeing a spin-off that it's striking younger children, Kawasaki kind of a syndrome. We don't know yet what the health implications long-term are for people who've been on ventilators for lengths of time who do survive. This is a profoundly serious and profoundly dangerous public health danger. It'd be hard to do business if we have got this going on in terms of getting people to work, to be able to do the work at the place of business, people who feel comfortable even to come and do business, to buy and purchase things with that kind of a backdrop. So we're trying to balance all these very serious considerations, as well as we're highly concerned, obviously, about an unemployment rate in this county, which is already in the 15% range. It's no one is dragging their feet. We're all interested in opening up, but as safely as we possibly can as well. And that would be good for business and good for everybody. Second question I have about the funding piece going forward. I understand that the emergency board is going to be making allocations that today. I think it is. I think that we're anticipating that there's about $400 million going to be released to local entities over a period of time, with the first 200 being available to counties not in Multnomah County or Washington County. What about do we have any sense of where that second round of 200 million, or is that yet a decision to be determined? Do we know?
That's dedicated for PPE?
But my question, yes, but my question is specifically, is there any sense of where, will the same restrictions with respect to Multnomah County and Washington County that apply to the first 200 million also apply to the second 200 million?
I think that's their intent, is that Multnomah County, the city of Portland, and Washington County received the CARES funding, and that they're not intending to provide state funding at this point. But I think we're all still... Period. We're all... That's my understanding. I think we're all still negotiating, pushing back on that. But at this point, that's what I believe. There are, and I think these are questions for the government relations team, but there is a lot of conversation that continues to happen about that, as well as other potential funding opportunities at the federal and state level.
Okay.
None of us are giving up yet.
Thank you.
So with that, do we have a motion to adopt the Emergency Operations Center COVID-19 reopening plan as amended?
Second.
We have a motion and a second. All those in favor, please vote by saying aye.
Aye.
Any opposed? The motion carries unanimously 5-0. Thank you very much to everyone involved, including our legal team.
I'd like to make one last comment as well, and I appreciate the consistent DEI lens that has been applied to this document all the way through, and including into the recovery piece. I think that's important, especially when we look at our numbers in Washington County in terms of our positive cases and what our communities look like. So thank you for that. And I just wanted to underscore the fact that coming to this reopening plan, the first lens was an equity lens, and I appreciate it.
Thank you.
I would second that. I'm very proud of this document. I think it reflects well on Washington County. We're an organization that's mindful of equity. We're mindful of the kind of needs that are out there, and it's a document to be proud of that we can share with pride with with others.
Thank you. I'm sure the team's listening, but I will pass it along to them. We appreciate your support.
And
I'm sorry, Marnie, could I get mine's all electronic. Could I get a hard copy of that document?
Yes.
Thank you.
You'll want a copy of the amended version. Yes.
Yes, we'll get you hard copies and electronic versions once they make these amendments. Yep.
Commissioner Rodgers, before we move on, your fellow colleagues have had the opportunity to say something more here. Do you have anything more you'd wish to say at this point before we move on to oral communication? Okay, thank you. Okay, the next item on our agenda today is oral communication to our clerk, Mr. Kevin Moss. Do we have anyone who's signed up?
Yes, we do, Madam Chair. We have Dale Feek, and I will bring him over for you.
All right, welcome, Mr. Feek. This is your opportunity to address the commission for up to 5 minutes. Our clerk will display a timer on our screen. I don't know if it has a noise or not. If it goes down to 0 minutes, I will call time out loud.
Can you hear me?
Yes, sir.
Thank you, Chair Catherine Harrington, Commissioners Skelton and Tree. I'm Dale Feek, Chair of Washington County Citizen Action Network and Project Director of Hillsborough and Water. I really want to thank you, Chair Catherine Harrington, Commissioners, and Marnie Kyle, and other members of the Health Safety Team for your extensive reporting and hard work and commitment to keep people in Washington County safe based on analysis of data of various sources, and particularly information from Governor Brown, our legislative leaders, and staff. So sincerely, thank you. Max Eggener, Pamphlet media reporter, wrote an article in the Washington County Times published Thursday, wrote it Tuesday, I believe. I emailed him and said I plan to use my public comment based upon partially of his story. In particular, Commissioner Jerry Willey, my commissioner, District 4, since I live in Forest Grove, in that article it stated that that you were concerned about the unilaterally aligning with them, Clackamas, Multnomah counties. If we have to wait a week for them to catch up, we're going to hear it loud and clear from our business community. But from my understanding now, from what was said, I think you've retracted that statement. I hope so. I can understand your statements if you have consistently made decisions as the mayor of Hillsborough aligned with business interest over public health sometimes and safety when it came to giving tax breaks to Washington County, Hillsborough corporations, and not considering the health effects sometimes of the semiconductor industry of air pollution in Hillsborough and Washington County. Because many people who work in Washington County also live in Multnomah and possibly Clackamas County, we need a unified reopening strategy as described by staff. The governors near the state of New York and the governors of West Coast understand this clearly. I agree with Chair, as reported in this news story, I agree with Chair Harrington's point of view, which corresponds to Governor Brown, which corresponds to Governor Andrew Cuomo of New York. Saving lives is more important than reopening the economy too quickly. Also stated in the article by Max Eggener, it said, Chair Harrington said, I don't think we should be opening consequences be damned. I do think we need to continue to try to move forward on a regional approach and see in the coming week or how our fellow counties are measuring up. I totally agree. I am concerned, well, and he also says, Brown's office said the goal with the phased reopening is to minimize hospitalizations and deaths and reduce risk to healthcare workers. I totally agree. Throughout Oregon, state officials now want residents to wear masks when entertaining any business, with exceptions for eating and drinking. And I appreciate your comments today, Chair Harrington, emphasizing all of you as commissioners. Even though our president of the United States is a very poor model, he won't even wear a mask when he goes to the meat factory. He's the only one that doesn't wear them. That's crazy. We need modelers. We need ones who will show people that they're protecting not yourself, but the people that are around you, because you may have the virus and don't know it and be giving it to other people. And I feel sad for the farm workers that the bill wasn't passed on a national level, because they then aren't having to follow. They aren't being protected, and there are critical workers, and they aren't receiving the same level of care and concern that we are in Washington County. So throughout Oregon, Max Igner says, state officials now want residents to wear face masks in entirety. I already read that. Okay. So please wear your mask, be good models. I appreciate that very much. 4 points of Governor Cuomo in his New York Forward, which I emailed all of you, and you have the document. You know, the infection rate is sufficiently low. The healthcare system has the capacity to absorb potential resurgence in new cases. Diagnostic testing capacity is sufficiently high to detect and isolate new cases, and robust contact capacity place to help prevent the spread of the virus. Thank you for detailed work necessary to recommendations. So let's be like Governor Cuomo in New York. Tough. Washington County, tough. Be smart, united, disciplined, and loving. Please be loving, do the hard work you're doing. Thank you for all your hard work. Thank you.
Thank you, Mr. Feek. Mr. Moss, is there anyone else who signed up to address us today?
No, Madam Chair, we have no other prerequisites.
Okay, thank you. Moving on to board announcements, I'd like to take a slightly different format here for board announcements today because it's been an incredibly busy time. So I'd like to ask our leadership staff, and that would be our interim CAO, County Administrative Officer, our County Council, and our Clean Water Services CAO, to each just see if there are any comments they'd like to make today. Mr. Interim CAO, Stephen Rhodes.
No, sorry, I'll take this off so I don't sound too bad. I just would like to echo everybody's appreciation for the hard work the staff has done to put this together. We met extra times to make sure that we were all comfortable with what we were bringing to the board, because it's a very, very important contract. And staff, I think, went out of their way to make sure that we got to the goal point that we are at right now. So I appreciate that from all of our staff.
Good work, organization. Thank you to all of our employees. Yay! Alan Rapplier, our County Council.
Yes, I would just like to echo Steve's comments. I'm just very happy we got what we did today done, so we can move on to the next step. There's much, much more work left to be done, but this is a good start.
Well, and thank you for supporting all of the employees in your organizations. Every employee is important to us, and we want to ensure that they are safe and healthy and doing what they need to take care of their families as well. And to our CEO, our Chief Executive Officer of Clean Water Services. How are things going?
It's great. Good morning, everybody. I wanted to echo my thanks to the EOC at Washington County and all of the Washington County staff, especially Marty and her staff. They've been very helpful to Clean Water Services as we pre-plan how we're going to de-escalate the emergency over at Clean Water Services. And we're very thankful for everyone. And thank you to the board. We really appreciate this next step and the guidance. It's very, very helpful.
Thank you. And to each of my commissioners, are there any thoughts that you wanted to contribute today?
Yeah, I just wanted to note, we have an election coming up on Tuesday, and today pretty much is too late to just expect it to get on time by the mail. So you need to start, if you haven't done it already, got it in the mail by yesterday, you need to drop it in one of our numerous drop boxes across the county.
And there is a page in your county voters pamphlet statement that has the address of each of those secure drop boxes. We have reports of people propagating an incorrect situation. Do not, under any circumstances, put your completed ballot in a library return slot. It is not a library book. Your completed ballot needs to be returned to an official ballot drop box. The voters pamphlet is also available online at co.washington.or.us. Go to the elections page, and if you have any trouble finding it, once again, call our CAO office. The phone number's on the website, or send an email to us as commissioners, and we'll try and get you that information. Other commissioners?
I'd just like to remind people that we are in the middle of our budget hearings, and this may be on your list here. So we had a budget meeting last night, and my understanding is it was very well attended on Zoom. So I'm encouraged by that, and I hope that more people will take advantage of listening in and sending in any questions or comments that they might have.
Great. Commissioner Willie, anything? Commissioner Rodgers, do you have anything more? All right, so I'll do the sweep here. Ordinarily under board announcements, the chair announces upcoming meetings. We will be having our standard set of meetings next Tuesday, May 19th. We have quite a marathon work session that takes up most of the day, but we also have a business meeting at 10 a.m. The following Tuesday, May 26th, it happens to be the day after the Memorial Day holiday. We have an afternoon work session at 2 o'clock and an evening board meeting. Then we have another special day on Wednesday, May 27th. In the evening, we have a set of public hearings for our budgets. For the North Bethany Community Service District, we have a budget committee public hearing starting at 5:30. For the Enhanced Sheriff Patrol District and Urban Road Maintenance District Combined Budget Committee, the public hearing is at 6:30 p.m. And then the county budget public hearing is at 7:30 p.m. You can watch those meetings on our county YouTube channel, or you can also attend via Zoom. If you have any questions on the budget, we have detail on our budget webpage for the email address that you can send your questions. I believe it's finance_officer@co.washington.or.us, and his phone number is there too, and I'm sorry I didn't bring that with me right now. Then we have meetings coming up in June. Tuesday, June 2nd, Thursday, June 4th will be our roundtable, and then Tuesday, June 9th. And all this information is posted in our work session packet for today's meeting as well. And any last thoughts? I'll just add some parting words. Please, everyone, stay healthy, stay safe, do your part so that we have a safe and strong Oregon. Thank you very much for joining us today. And thank you to my colleagues for being available for this special emergency meeting. Thank you. Oh, sorry. I need a motion to adjourn.
I move for adjournment.
Second.
We have a motion and a second. All those in favor of adjourning, please vote by saying aye. Aye. Any opposed? The motion carries 5-0. Now we get to adjourn. Thank you. Bye-bye.